A number of years ago, I started suffering from some abdominal pain. At some point, the pain became so severe that I decided to go to the emergency department. And once I was there, I was seen by a doctor who examined me and then sent me for tests and scans. And together we decided that surgery was the best course of action. And within 24 hours of my surgery, I was sent home with only the pain from my incisions, and I was able to live my life normally again. But this was not the story for Masika. Masika is 35, just like me. She's a young mum, just like me. But unlike me, she lives in Wallycolly. Masika started to develop abdominal pain, and when it was so severe, she decided to visit one of the very few doctors in her village.
Doctors in Congo train at medical school for 7 years. During that time, they have very little patient contact and very little practical training. When they graduate, they often take a job in a rural area because that is the only place they can get a job. Sometimes they are not even paid, but they take the opportunity to put into practice the things that they have learnt in books, or at least they think they've learnt.
When Masika visited her local doctor, he didn't examine her. He didn't send her for tests or scans. He just decided to operate. And when Masika awoke from the surgery, she still felt pain. The doctor never told her what he did during the surgery. She was just sent home about a week later, in spite of the pain she was still feeling. After the operation, Masika's menstrual period suddenly stopped. And about 4 months later, she started to develop some new symptoms. She began to excrete bodily fluids, and this caused many difficulties. She started to have a smell which meant that people didn't want to come close to her. Even her own children didn't want to be held by her. Masika endured this for a time, but she decided to go back to her doctor. But when her doctor saw that there was no infection, there was no fever, he said there was nothing else that he could do. And so Masika continued to suffer. After living like this for 8 months, a plane flew to Wallycolly, and on that plane was medical supplies and a doctor. And this was very rare for the town of Wallycolly. Masika decided to go and visit this doctor. And this doctor examined her, unlike her local doctor. And when he did, he found a mass in her abdomen. And on his recommendation, she flew with them to Goma to visit Heal Africa Hospital for further investigations. When Masika arrived at Heal Africa Hospital, she saw Dr. Medard and another young doctor. They could see that she wasn't in great shape and she was dehydrated, so they started her on antibiotics and a drip. And after some tests, a few days later, they decided to operate.
Dr. Medard, my surgical colleague at Heal Africa Hospital, examined Masika when she arrived there, and he found that she had not only an abdominal mass, but also a fistula, a connection between her bowel, her urinary tract and her vagina. She could not afford a CT scan before the operation, so can you imagine their astonishment when they found at the time of surgery that her uterus had been removed, and the doctor who'd had performed the initial surgery had not even told her. The mass was in fact 2 different parts of the bowel, which was connected along with the urinary bladder to the vagina, and that explained why she was leaking urine and feces and smelt so much. The whole thing was such a mess that they could not perform all of the surgery in the first operation, so 48 hours later she had a second procedure where they were able to join the ends of the bowel together. She spent a total of 49 days in hospital, during which time she needed a third operation, but eventually she was able to be discharged alive and reasonably well, though she needed a lot of nutritional and psychological support.
Imagine having your uterus removed without your permission or your knowledge. Masika will have to bear the scars, emotionally and physically, of this terrible treatment for the rest of her life. And while she's left asking the question, why would they do this? Why would they not tell me? She is filled with gratitude for the doctors at Heal Africa Hospital who intervened into her situation and provided information and healing from the pain that she was suffering.
The sad part about Masika's story is that this is not uncommon. Walikoli, where she lives, is not a safe place due to insecurity and poor health care. It's also a part of Congo where in the past many women were raped, and it continues to be an area where many patients with medical injuries are referred into Heal Africa Hospital. And it's all due to this lack of practical training. The even sadder thing is that this is not uncommon in Congo. Walikoli is just one example, but there are many places like this, particularly in the East, where doctors, young and not so young, have very little practical training. OzHeal wants to do something about this so that women like Masika do not have to experience the horrors that she went through. She survived, but many others will die, and many will continue to die unless there is some change. You can be part of making a difference in this part of the world. Will you help us to raise the funds to roll out a short course to train rural doctors to respect the dignity of life, to learn some basic skills of surgery, obstetrics and anaesthesia, and importantly, to know when to call for help? We want to respect and protect the women of Congo and empower doctors to provide better medical care.